guys, welcome back to my channel. In this video today, I will compare pros and cons of MRCP-UK versus MRCP-Ireland exam. So, first of all, I will discuss about the parts of each exam, about the time duration that is required for each exam, and about the difficulty level of the exam, and which one is good for the career to go ahead, and about the exam pattern, and study material, and the expenses of the fee. So MRCP UK, it has three parts. MRCP UK part 1, which is a written exam, then there is a part 2 which is also written exam, and the third one, which is clinical, it is also called as PACES exam. And on the other hand, for MRCP Ireland, there are three parts as well. First part is known as General Medicine Part 1, second one is General Medicine Part 2 written, and third one is General Medicine Part 2 clinical. These are the parts of each exam. Now let's go on to the pros and cons of each exam. So the pros of UK exam is, if you want to get into the higher specialty training in UK, then it's very important for you to pass your MRCP UK exam, because they have separate scoring criteria for MRCP UK. It's very less likely that if you are extremely lucky only, then you can get into the higher specialty training of UK exam. Otherwise, it's a mandatory step to get into the higher specialty training. For higher specialty training, I mean that if you want to go into specialty training directly into ST3 and ST4, in which you are usually exempted from internal medicine training, IMT training, 2 to 3 years training is exempted in this. So that is the greatest pro and benefit of the MRCP UK. Another thing is, if you want to get GMC registration, you don't need to give PLAB. You can get directly GMC registration by the route of MRCP. And also an MRCP, it doesn't need OET exam before the membership exams. You need to pass the membership exam. Once you clear all the three parts, then the usual procedure, which I have discussed in my other video of GMC registration, that is the usual procedure. After the MRCP exam, you need to give OET and go ahead with the further process. So these are the two major benefits: first, to get into the higher specialty training, and second, to get the GMC registration and start working in UK. Now the Irish Medical Council exam, which is MRCPI, actually the time duration, the exam, it is easy as compared to the UK exam. There is less time duration for each exam. Like in MRCP Ireland, there are three parts as well, but the exams are relatively easy. The number of questions, they are relatively easy. The time duration is relatively less, and the chances to secure a slot for your clinical exam and to finish all the three parts in 1 year is comparatively more as compared to UK. And to be very honest, from my experience, I never heard anyone finished all the three parts of MRCP UK in same year. But I know many people who finished all the three parts of MRCP Ireland in 1 year. So the chances to get slots, the exams are more frequent. The chance of getting a slot for clinical exam is more easy for MRCP Ireland candidate as compared to MRCP UK, because usually it takes many years to get a slot to secure a slot for MRCP UK PACES exam. Another thing is, MRCP Ireland exam can be held online. Both the part 1 and part 2 you can give by sitting at home. You can prepare yourself, and it is usually an online exam which you can give anywhere. If you are at work and you want to take a break, okay, and if you are at home, you want to give the exam, you can give. About the further details, I will share with each part of the exam separately, that what is the exam format, and what are the conditions to sit for an online exam. Third thing, the exam questions are relatively easy and straightforward in Irish exam. Fourth thing, you can get GMC registration with the Irish MRCPI as well, but you cannot get into the higher specialty training with MRCPI. As I mentioned earlier, that it's very less likely that people are securing. I know only one person till now who secured with MRCPI, but not the specialty of her interest. So with MRCPI, it's less likely to get into the higher specialty training. For that, it's mandatory to get MRCP-UK. So these are the pros and cons. But on other hand, with MRCP-Ireland, you can get GMC registration. You can work in UK as well. But with MRCP-Ireland, you can get IMC registration as well, which is Irish Medical Council registration, and you can apply for higher specialty training in Ireland. I heard it's very difficult to get training there, but nothing is impossible. If you have a dream, you can chase it. And once you will struggle and you are hardworking enough, then you can get your dreams. So this is the main difference between MRCPI and MRCP-UK. Regarding the fee is more or less the same. There is not much difference, only few pounds difference, but it's not important. The fee is almost the same. The expenses are the same. So let's move to the MRCPI Part 1 exam structure. So MRCPI, which is MRCP Ireland, membership of Royal College of Physicians of Ireland, Part 1 exam, it usually consists of one single paper with 100 MCQs. And you have 3 hours to complete the exam. There is no negative marking and each question is equally weighted. So I strongly advise all of you to attempt all the questions. Whoever is intending to sit in the exam, try to attempt as many questions as possible, because all of them have equal weightage, and the exam is straightforward, simple, 100 MCQs. And as I mentioned earlier, it is a remotely based exam you can give at home. Second thing, how to prepare for this exam. So it is important not to underestimate this exam as well, because it really need preparation. Without preparation, you cannot pass MRCP Ireland as well. The exam format is more or less same like the pass medicine and on exam. When you are working in a busy clinical job, it usually takes 3 to 4 months of preparation. But if you are staying at home and studying full time, then it usually takes 1 to 2 months. But as I mentioned earlier, it needs hard work. You should study well for this exam as well. So this is remotely based 3 hours exam, and the study material which is best for the MRCP Irish preparation is on exam and pass medicine. Try to study at least 2 times each one of them, pass medicine and on exam. In between, if you are confused with anything and you want to study any other material, then follow the Oxford Handbook of Clinical Medicine. Okay. Next thing is, what are the entry requirements of MRCP Irish exam? It just needs 6 months of preparation, 6 months of postgraduate experience after passing your MBBS degree. After getting your MBBS, you need 6 months clinical experience, and then you can sit for MRCPI part written part 1 exam. Okay. So usually the application period is open thrice in a year. You can check the MRCPI website for the application dates, when they are open and what are the fee. But usually they ask for your MBBS degree, which is primary medical qualification. There is some criteria that it should be attested by the lawyer or notary public or solicitor or the issuing university or medical school or embassy if you are in another college, if you are in another country, embassy or higher commission. So there is a set criteria. Your degree should be attested by them in order for your application to be accepted. And if you have already Irish Medical Council registration, then instead of your degree, you can just provide them your IMC registration number to go ahead with the exam. And if your medical degree is not in English, then it need to be translated to English to be accepted. So there are certain people who are exempted from MRCPI Part 1 exam. So this exemption you can see on the official website, but I will just give a general look. If you have MRCP UK complete, if you have FRCP, if you have MRCPI Part 1 of Pediatrics, if you have MRCP Pathology, if you have Arab Board in Medicine and Pediatric, Saudi Board in Medicine and Pediatric, Omani Specialty Board in General Medicine and Pediatric, Kuwait Board, MRCP Psychiatry, FCPS and from Pakistan even. Full FCPS is equal to only MRCPI Part 1 exam. Okay, American Board in General Medicine and Pediatric and Malaysian Board. These people are exempted from MRCPI Part 1 exam. Next one is the application fee. The fee to sit in Part 1 exam of MRCPI is usually €690 for both Irish and overseas students. But in next year they are going to increase this by €20. From 2024 it will be €710 for both Irish and overseas student. Usually the method which is used for the payment is by debit card or credit card. And another thing, if you have any emergencies before your exam and you are unable to sit for exam, then you can write them the reason, and they are very good in this thing that they are providing full refund of your examination fee if there is valid reason. So the remote invigilation what is the meaning of remote invigilation? It means that you should sit in a quiet and secure environment, a room where the candidate can take exam without interruption. You should have a PC or laptop. Just remember that this exam is not conducted on the mobile, so you should arrange a PC or laptop with good internet connection, webcam and microphone, because your video will be on all the time during the exam. It's just like a physical exam that the examiner is looking at you. So in MRCPI exam also an examiner is looking at you full time. Okay, and the device must have permission and be enabled to install the software. They will send you an software to be installed and in your laptop or computer, and you need to check it that this is working properly before your exam. Make sure of this thing. Multiple screens, headphones and earbuds are not permitted. You need to provide them with your identity in the form of driving license or passport or public service card. And a scrap or rough paper is not permitted during the exam. They will provide you with a virtual notepad if you want to write anything for your rough estimation. And the mobile phone must be within the reach of the room while sitting in the exam. Mobile phone is usually for the registration or technical support purpose only, and it is not allowed to be used during the exam. Or you can use it to connect to your laptop or system. Sometime if your Wi-Fi is not good, then you can turn on the hotspot from the mobile phone, but keep it on the silence mode so you will not be interrupted during the exam. Okay, some people will have question that what is remotely invigilated exam. Again, as I mentioned, that it is a computer-based exam by the help of a special app and supervised over the internet connection by an invigilator. Okay, your invigilator guides you through some authentication and validation procedures such as checking your ID and checking your environment. They will ask you to turn on the camera and rotate the camera all around your room to make sure that there is no one else in the room. And also they will look at your table and what's under the table to make sure that you don't have any book or any study material around you. Okay, and during the exam everything will be recorded. Okay, so next is what time the exam is started. Exam time is usually communicated between you and your invigilator at least 5 days before the exam to allow registration and security check before you start the exam. Start times can be a little bit staggered, but they will usually make sure with you that what time it's suitable for you according to your time zone. So select the time according to your convenience. Okay, that all the exam times are given as local times based on the time zone of your computer setting and the region you are living. Okay, so please ensure check your details on the confirmation email when you receive it. Okay, next query could be that are there any breaks allowed during the exam? Because it's only a 3-hour exam, so it's better not to take any breaks. If you are confident enough and you have finished your exam before time, then you can go for the bathroom break of 5 minutes maximum. Only one bathroom break of 5 minutes is allowed during the exam. Okay, and if the examiner and invigilator has noted any suspicious behavior during or after the break, they will directly report it and you will be flagged for the review. Next, are the drinks allowed? Or rough notepaper. Notepaper is usually not permitted during the remotely invigilated exam. for some exam they will provide you with an online calculator if you have any calculations, and then they will provide you. And regarding the drink, you can have a drink with you, usually in the clear container. Even the water bottle, they will ask you to remove the tag from the bottle, so it should be completely crystal clear. And the name of the app which they will send you to install in your system is Test Reach. They will send you the link to download it and then test it if it is working. And they will provide you with the support number. If you are finding any difficulty, you can write them email or call them on the supporting number. Okay, and that's it. Let's move to the next part, which is about the exam structure. As I mentioned earlier, that MRCPI General Medicine has total 3 parts. So examination consists of one paper with 100 single best answer questions. You have 3 hours to complete the exam. There is no negative marking, as I mentioned earlier. So try to attempt the exam fully. Okay, and single best answer usually followed by the 5 possible answers. There are 5 choices. You need to select the single best. Okay. And the questions in the paper are selected to achieve a balance spread across medical specialties. The science underlying evidence-based medical practice and the basic skills required in general medicine. Actually, there is not a clear-cut criteria of how many questions are from this. They just give a rough estimate, like the major medical specialties like cardiology, gastroenterology, and respiratory. They will hold the major number of MCQs, like 10 MCQs. This is a rough estimate, but most of the MCQs will be from major branches of the medicine, and some of them will be from the minor branches, and they are not equally distributed. Okay, and also the marking is not equally distributed. Marking is also relevant. It's according to the level of difficulty of the scenario. If a scenario is very difficult, then it will hold more score, as compared to the scenario which is easy, it will hold less score. Okay, but the questions are usually based on the important diseases, common diseases, or community practice. At least 75% of the question will concern direct clinical care of the patient and outpatient in hospital-based setting. Correct answer will be within up-to-date guidelines for diagnosis and management. Basic science questions may cover anatomy, bacteriology, biochemistry, immunology, metabolic physiology, etc. as well. There can be some basic questions as well, and 1 or 2 questions from statistics as well. Okay, so next step is how to prepare. It is important to prepare for MRCPI exam carefully as well. You should practice single best answer questions by using the books or online resources. The best books or online resources which I usually recommend to the fellow colleagues are on exam for MRCP Part 1. Some people are studying on exam for MRCP Part 2 as well, but for me myself, I studied only on exam MRCP Part 1 along with the Oxford Handbook of Clinical Medicine and Pass Medicine. These 3 are the best sources to get through your MRCPI Part 1 exam. And of course, your basic knowledge matters as well. If you have good basic knowledge, then you just need to go through them at least once. But if you are not holding enough knowledge that you can guess while solving the MCQs, if you are solving most of the MCQs, only 1 go is enough. But if you are securing less score, then I would recommend to revise at least 2 times each one of them. Okay, and you can find the study materials easily on the WhatsApp group and the Facebook group as well as Telegram. I will share a link for each of them. The online resources the best. I will share a link in my description box as well. So make sure you check the description box if you are looking for the study material. But I would recommend to take online subscription of Pass Medicine and On Exam, because that is the most updated version. Okay, MRCPI General Pass Part 1 examination. Regarding the exam for 2024, usually the exam Part 1 exam date will be on 22 August 2024, 25 April 2024, 25 January. So the next 4 exam for MRCPI Part 1 would be first one on the recent 24 August 2023, and next year the same curriculum will be repeated, 25 January 2024 and 25th April, then the fourth one will be in August, 22 August. And the fee already I have mentioned. So yeah, This is it about MRCPI exam. Again, I would just mention that MRCPI is relatively easier than MRCP UK. Now let's move to the MRCP UK. I will explain everything about part 1 exam only. Regarding the part 2 and clinical exam of both of them, I will make a separate video for both of them. MRCP part 2 preparation, then MRCP clinical preparation, and how I did my study and how I passed my exam. So MRCP UK part 2 exam, first, who is eligible for the exam? Actually, you need a 12 months experience after your MBBS is compared to the Ireland. Ireland needs 6 months experience. Here you need 12 months of postgraduate experience in medical employment after your MBBS. Okay, and so it needs your basic knowledge as well as your clinical knowledge should be good enough, and you should be confident enough to sit for the exam. Part 1 is the first component of sequence of assessment. It tended to match the progression of trainees undertaking the core medical training. Okay, if you are intending to plan for the IMT training, then this is like the basic exam you need to pass for IMT. So how is the exam structured? Usually it is a one-day, single-day exam. In UK it can be conducted online, but for other countries it's a physical exam. You need to go to the exam center and sit in the exam physically. It is a one-day exam, usually 3-hour duration. There are 2 papers. For each paper there is 3 hours duration, and each paper is consisting of 100 multiple choice question with 5 options. You need to select the best one. There are no images in this exam, and as I mentioned earlier, it could be computer based. For some of the international centers are also providing the computer based, but mostly it is in the UK. And regarding the application time and date and fees, you need to check the online website of MRCP UK, www.mrcpuk.org. Okay, so you can see the exam dates of your particular center. Usually the exam takes place in the month of January, then next one in the month of May, and then next one in the month of August, and sometime these are 3: January, May and August. August is usually the application time, and sometime nowadays they have tried to make additional attempt as well, but in our time there were only 3. So nowadays there is additional attempt in October as well. So for the exact dates, please check the website. Okay, and regarding the exam regulations, there are exam regulation like for the MRCPI. So here also they have exam regulation. You need to take your identity card with you. Either it could be your passport, or it could be your local ID card, or it could be your driving license. These 3 things are usually acceptable. Okay, and regarding the online exam, there is a set criteria, the same like MRCP Ireland, but they have some differences which you need to check on the website. But I will just share a rough update about what is usually they ask you to professionally to wear your clothes professionally, to have a professional dress, and wearing a watch is not allowed. Looking at the hands or wrist is not allowed, and taking screenshot of the exam content is not allowed. Room too dark is not allowed. Calculator is not allowed. Smoking is not allowed. Computer with webcam or PC is allowed, and the same they have the pre-examination test which you need to complete before going for the exam. And one extra thing which is for the MRCP UK is you need to create an account on MRCP UK website. Okay, that is the process of applying for the exam. First you need to create an account, check that all your personal details are up to date. It is very mandatory because your exact name, everything should be accurate, because this is going to reflect on your diploma. Okay, and these details are very important regarding your clinical examination as well, so make sure that you complete them accurately. Okay, and fill in the details about whether you are intending to apply for training in UK or not. Choose a center where you would like to take the exam. Complete any special arrangement where applicable. Pay for the exam. Once your application is submitted, you will now be assigned an RCP code. So this RCP code is your examination code, which is going to be your MRCP code for all your life, for part 1, for part 2 and part 3, all the exams. Okay, and regarding creating an account, there is a video given on the official website of MRCP UK. You can watch this video before creating an account. If you have any queries, you can comment in my comment section for any assistance. I would be glad to help. And regarding the eligibility, as I mentioned earlier, that after MBBS, 1 year experience of medical employment, and your degree, primary medical qualification should be attested by an FRCP holding doctor. This is their criteria. They usually accept the copies of your qualifications as well once the registration period is open. That's it for today, and this is all about MRCPI versus UK Part 1 exam. And if you like my video, don't forget to subscribe, share and comment. Thank you so much. See you again with second part of the exam. And regarding the examination dates, usually, as I mentioned earlier, it's 3 times in a year.